Try holding your nose, close your mouth and count as fast as you can to 100. An increase may lead to a deficiency in oxygen. This is voluntary. Now imagine the same happening to a person with asthma on more than one occasion, unexpectedly. Asthma, the most common chronic disease, especially in children, has some inheritance to it.
It's a non-infectious disease that some people can have. It has symptoms of wheezing, cough, and maybe chest tightness, and essentially it's a difficulty breathing.
These are some of the symptoms that 5-year-old Shalif Sempija exhibited at 3 weeks old.
Then second time, era naddamu ekintu kyekimu nakikontinue nga kyajja nga kyamaanyi nnyo. Ne tumutwalako era mu kiliniki negamba tekyasobola mujjanjaba.
The third time he was brought to Nsambya Hospital, where he got proper diagnosis and treatment.
Ne kati takyakolola era assa bulungi.
Prosi has to ensure that her child receives quality care, and that's why she keeps in touch with doctors. The fragility of his health may make him miss out on a lot as a child, like it was the case for Sagita Daisy.
I used to do some gymnastics when I was younger, and I participated in some local competition, but I couldn't do that anymore, of course, because when I was exhausted, I had asthma, so my parents wouldn't let me.
For 20 years now, Sagita has been having asthma. Doctors diagnosed her with the lung disease at 10 years of age.
The first time we found out I had asthma, I had to undergo a treatment by having this injection twice a day for 2 years. Twice a week, for 2 years, which was not easy. I had to stop playing to go to the doctor.
She says this is a painful memory, and that's why she's attached to a spray.
My bronchodilator and sometimes corticosteroids.
These are the internationally recommended drugs listed on WHO's essential medicine list. Most are referred to as rescue drugs because they save an asthmatic from an attack.
The best way to treat an attack, especially in children, is to give the medicine by inhalation. Many times you find people give medicine differently. There are ways, in other words, you are introducing the medicine directly into the lungs where the problem is. That allows you quicker action, but also it allows you not to give a big dose. Because many of these drugs have other effects, bad effects to the rest of the body.
Unfortunately, not many people globally can access and afford the asthma medicines.
The International Union Against Tuberculosis and Lung Disease is trying to make these medicines more affordable and accessible for countries and for patients who have asthma. And we have an asthma drug facility which is, does quality assurance on asthma inhalers, and countries can buy these inhalers at affordable prices for their patients.
Asthma, like tuberculosis, is not without stigma.
Some kids didn't want to play with me because they thought I was infectious. Even some adults who are in my, let's say, family members or neighbors, they wouldn't let their kids to play with me.
Being a problem that requires long-term treatment, utmost care must be taken, and this requires knowing what triggers the attacks or episodes. Just about anything can trigger an asthma attack, be it this pillow or the material of this cloth. Sagita discovered what her trigger was: cold weather. She stays in a warmer area, but the sad thing about it is that she cannot live with her family who stay near a mountainous area that is usually cold.
Sometimes you want to spend time with your family, but you can't because you have you go back, but you can't really enjoy your time with your family because you are struggling to breathe.
This is however not helped by bad air. Most attacks are associated to the things sufferers inhale.
One of the biggest contributors is the environmental pollution that we have.
Indoor air pollution, like some of the fuels and smoke, smoke producing heating and cooking inside the house.
We are lucky we don't have a lot of smoking, but there are countries which have so much asthma because they have so many people who are smokers. So you have children who don't smoke, but they are what you call passive smokers.
Asthma does not kill as many people as HIV and tuberculosis, but it does impact negatively on the quality of life of those with it. Uganda's Minister of Health is yet to get the statistics and determine the burden, but according to hospital visits, it is a big problem.
It's one of the non-communicable diseases that we are aware of. It's very common. All our health facilities have medications to relieve it, but not to cure it. And in children, sometimes they outgrow it.
According to the International Union Against Tuberculosis and Lung Disease, globally 250,000 people die each year because of asthma, and over 235 million suffer with this disease. At Nsambya Hospital, a once-in-a-week clinic has been set up to see to it that patients are managed from the onset to long term, rather than when they go home without any follow-up, specifically for children. Asthma is an area of public health where a big difference can be made as long as the public know that it is manageable, treatable without any encumbrance, and not contagious. Florence, NTV.